Hello, my name is Dylan McDonald. I'm going to be doing palpation of the elbow region. First, I'm going to ask consent of my patient. Is it okay if I feel structures at your elbow?
Yes, sir.
Gave note that the patient did give consent. So the first thing I want to find is the bicep brachii. And it's a pretty easy muscle to find, but to make sure I'm on it, I can ask the patient to lift their hand toward their shoulder. And I can strum across it in the horizontal plane and find the bicep brachii. I can even go down, and I can feel that distal tendon of the bicep brachii and have them relax. And then move medial from that distal tendon and find the brachial artery to take their brachial artery pulse. And then so next is we have the bony prominence right here is the lateral epicondyle. We got the olecranon process, and just above the lateral epicondyle is the lateral supracondylar ridge, and I can have the patient's hand in a neutral position, not supinated, and ask them to lift their hand toward their shoulder again and feel it contract and follow that muscle belly all the way along to the distal end of the radius. And so next I'm going to find the extensor digitorum, and so I'm going to go from the lateral epicondyle, kind of move a little bit closer to the ulna but not on it. Ask the patient to extend their wrist up and then their fingers as well, and I can strum across that muscle belly. And then the next thing I'm going to find is the radial head. So I'm going to go distal, maybe a little bit more medial, have the patient supinated, and I can feel that bony prominence, and I can turn their hand over, and I can feel that radial head within the annular ligament. And then the next thing we're going to find is the flexor carpi radialis, and so I'm going to passively move the patient into flexion and radial deviation and ask the patient to not move their hand. So I'm going to give resistance and then have them relax. And note that the flexor carpi radialis tendon is lateral to the palmaris longus, and to feel the palmaris longus, ask them to touch their thumb and pinky together, and I can see that palmaris longus tendon. And then next I can have them in flexion and ulnar deviation and tell them not to move, and then hold that position, and then it is medial to the palmaris longus. And also I can find it from the flexor carpi ulnaris from the pisiform and just move proximal, and I'm on that flexor carpi ulnaris.